Thank you so much. Really appreciate it. And next, Frida Patterson, would you like to share your experiences at Concerted Care Group?
Hello, everyone. I'm Alfreda Patterson. Everyone calls me Frida, and that is what I prefer my clients to call me also, because it actually makes them feel comfortable that they know they can come to me and talk to me about anything that they need. So I'm a substance abuse counselor and a housing coordinator at Concerted Care Group. And I've been there for 3 years. So one of the things that I like about our facility is we are integrated. And by us being integrated, that means we actually meet the client exactly where they're needed. So we do substance abuse, mental health, health home, psychiatric rehabilitation services. Also, we have other programs within the facility too that we can provide different services for our clients. One of the things that is very near and dear to me is our housing component. So we have housing. There's a lot of clients that come in that are homeless and need housing. So we assess them, we meet with them, and we make sure that they are actually eligible for our houses. And some of the criteria is not that hard. We actually hook them up with services with intensive outpatient. We're like the group center. We have groups every day from Monday through Saturday. They can come to groups all day long. Do 1 group, 2 groups, 5 groups. It doesn't matter. So we have IOP groups. We have OTP, which is opiate treatment placement groups, because we are a MAT facility. So we do methadone and we do Suboxone also. But we also do mental health. We have trauma group, grief group. We are surrounded with nothing but groups and the therapeutic teaching of our facilitators. So engaging in housing with the population that we serve in Baltimore City, it is a grave population, and it's true dear to my heart too, because I come from that population myself. Not many years ago, over 22 years ago, it was me that needed services. So when I needed those services, the services were just not available as it is today. So I only knew one route to go, and that was a route to do MAT. So back then, of course, it was stigmatized, and it's still stigmatized today. But that is how I got to this point today, and in order to go to college, get a degree, and to help other people that needed to be helped, just like myself. So I'm always open to talk about this with clients that need to be talked about, that need me to talk about this to them, because sometimes they really don't think that I know what I'm talking about, or that a lot of us know what we're talking about, because we're book people. But when they find out, no, I've been exactly where you've been, and I feel what you're feeling, they kind of get that sense, well, okay, I think I can trust her. That is the number one key, to build that trust with your patients, with your clients, whatever you prefer to call them, customers. You build that trust with them, and you try to get to know them. Therefore, they can get to know you and know that they can depend on you. I'm an advocate for our clients at CCG. They can come to me with anything that they need, and I will make sure and try to get those services for them. If we don't provide the services with Concerted Care Group, we send them out to other outside agencies. Of course, some of our clients will need other levels of care, and that's 3.7 level of care. We have partners with other agencies that will provide those levels of care for them. But the primary thing is to get them suitable housing. And we're talking about suicide. We're talking about why not feel like killing yourself when they have nowhere to go. So we try to make sure that they're linked into our housing with the proper services. Before getting in housing, we get you intensive outpatient or other treatment that you might need, mental health services. As soon as you come in the door at intake, we refer you to these, because we use a tool with the mental health screening tool. Therefore, we know how to place you in those particular services that you do need. So it is very, very clear that they need these services. It's very clear that we're here to give you all the services. But of course, housing is just not enough. We have a small amount of housing. We need other housing. We need to talk about more housing for our clients so they can have somewhere to live. And I notice that our clients that are in housing, they do so much better in treatment. They go to groups. They're getting jobs. I have one client that has a job with Humane Society. Another client works in Giants food market. They're doing different things. So with PRP, they actually help them look for employment, send them to different trainings. So our clients are engaged, and they're engaged. It's a lot of them that are engaged every day. So, like I said, with group attendance, our group attendance is great, but we are there to support them, and I am one of those advocates that will support them, and I'm here to help them. So that's all.
Great.